welcome all of you to help us celebrate this special occasion. Spring is a time for new beginnings, and it's not too hot out here this morning at UNC Asheville. But springtime is an especially wonderful time to think about new beginnings and to break ground for this new facility on the campus of the University of North Carolina, Asheville. Today, of course, isn't actually the beginning of this project at all. As most of you know, the plans and dreams for the North Carolina Center for Health and Wellness began several years ago. That we are here today is due to the hard work and dedication of many who are with us today and others who are unable to be on campus but are with us in spirit. And I'd just like to take a few moments to recognize some of the dreamers and doers that have made today possible. First, the leaders of this campus, our Board of Trustees. May I ask those members of our Board of Trustees, current and past, to please stand. I also want to especially recognize former member of the board, Dr. Luther Barnhart, whose championing of our role in developing future leaders in the fields of healthcare encouraged and fortified us on this path. I would also like to recognize former chancellors for their work on this important opportunity for our state. We are also pleased to have with us Graham Fields, representing Senator Elizabeth Dole, Steve Green, representing Senator Richard Burr, and Bruce Peterson, representing Congressman Heath Shuler. Will those representatives please stand, or if you're standing, wave at the rest of us? We are also honored to have with us today members and former members of the North Carolina General Assembly. Senator Joe Sam Queen, Speaker of the House Joe Hackney, Head of our Western Delegation Bruce Goforth, and Representatives Susan Fisher and Ray Rapp. Will all of you please stand up and let us thank you? I'd also like especially to recognize former Representative Wilma Sherrill, who for 12 years committed her time, her very considerable energy, and her many talents, most especially her power of persuasion, for the citizens of North Carolina and particularly for this region. Her passion for this project is legendary, and we are grateful for her enthusiasm and perseverance. Wilma, I have heard you say that every day you were in the legislature, you had the people of your district and UNC Asheville in mind. We are so proud to be hosting your dreams for us and your good work on our campus. To our legislative leaders, I want to say that it is your foresight and leadership, your dedication and service to the people of North Carolina that was so crucial to the success and the very beginning of this project. It remains central to the advancement as we watch this dream become a reality. It is your belief in health and wellness as key components to economic development of the region that will so dramatically improve the quality of life of our citizens. Our university's relationship with our county and city governments has never been better. We are pleased to welcome them and many other local partners. Nathan Ramsey, Chair of the Buncombe County Board of Commissioners, and Commissioner Carol Peterson are here. From the City of Asheville, we're pleased to have Council Member Holly Jones. In addition to partnering with governmental agencies, we are pleased to have the opportunity to work with agencies and individuals throughout the region. In particular, I would like to recognize the support of Mission Hospitals and MAHEC in affiliating with us for the community health enhancement programs already begun. I would especially like to recognize Mission Hospital's president, Joe D'Amore, who has been a true leader in bringing best practices and state-of-the-art equipment and facilities for healthcare in this region, and for encouraging our work in wellness and for supporting this project financially. Will you help me thank all of those community partners for being here? The appropriation we received from the legislature assured that we would have a dream, but to make that dream come true, we would want to let you know that there are individual donors and organizations from whom we have raised almost $5 million so that we can upfit and have the North Carolina Center for Health and Wellness that will serve all of the purposes that we have in mind. And so I'd like to thank the following donors to this project. If you are here and affiliated with these groups, please stand and wave. The Kimmel Group, the Cliffs Foundation, Home Trust, BB&T, and Pepsi. This glorious new facility will be right here, and like our university, interdisciplinary and multi-purpose. The design of the building has been an important process that involved our Board of Trustees, students and faculty and administrators, and operations folks all along the way. Our architects are Asheville-based Bowers, Ellis, and Watson, and we want to thank them for their work and their multiple trips back to the drawing board to make sure that we got this project just right. It's been a real pleasure to work with them. Will the representatives of Bowers, Ellis, and Watson please wave? Most of you already know them, but I want to take this special opportunity to recognize our Health and Wellness Project team. I've already remarked a bit about Wilma Sherrill and the dynamo she is. I also want to make sure that you recognize Keith Ray from our faculty, who has been involved in this project from the beginning, and our project point guard, Janet Cohn, who has been doing this for our university, not just for an athletics department. May I ask those three people to stand and receive your applause and thanks. They and many other current and former members of our staff and administration have helped to make this day possible, and we thank all of you for your service. Our UNC Asheville Board of Trustees has worked closely with previous and current administrators, faculty, staff, and students to keep the plans for this building moving forward and helping everyone to realize the best possible facility. Our trustees support the need for this center, not only for UNC Asheville, but for the community at large. We are so pleased to have a wonderful community advocate as our board chair, Janice Brummett. The benefit of Janice's counsel and leadership and guidance on this project has been outstanding, and it's now time to bring her to the podium. It is my pleasure to introduce to you Chair of the Board, Janice Brummett.
Well, good morning on this blustery day, but on behalf of the board, it is my pleasure to welcome you here today, and it's my true joy to be able to celebrate with all of you today this significant milestone in our collective UNC Asheville history. As we stand on this hill that overlooks the community as well as much of our campus, we are reminded of how central this university is to Asheville. This new facility and many of the new research and collaborative programs that will evolve as a result of such potential for preventative and wellness initiatives for our community will add significantly to the number and quality of area healthcare workers. That fact comforts me greatly as a member of the community. I too would like to thank our legislators for their help in making this day possible. It is heartening to see how seriously they consider the needs and desires of our citizens. And I believe this facility and our educational programs will help improve the health and wellness of many people throughout North Carolina and this region. Now, I have a proclamation to present to you on behalf of the UNC Asheville Board of Trustees. It's a little long, but it has a lot of important things to say, so I want to take a minute and read this to you. Whereas the citizens of North Carolina deserve the highest quality health care assistance with prevention of chronic diseases and more and better information on wellness, and whereas the General Assembly of the State of North Carolina has an ongoing commitment to develop an educated citizenry, and whereas the General Assembly of the State of North Carolina has identified the need for additional research into health and wellness, the need for more and better trained healthcare providers, and the need for programs that support healthier lifestyles and prevent chronic health problems. And whereas the University of North Carolina's UNC Tomorrow's Commission has outlined as one of its major findings that UNC should take the lead in improving health and wellness in North Carolina. And whereas the University of North Carolina Asheville is responding to UNC Tomorrow with strategies to increase the number of undergraduate research projects related to health promotion and disease prevention, to increase the number of graduates majoring in health and wellness promotion, to collaborate on intergenerational projects with a diverse senior population, and to collaborate with mission hospitals to contribute more prospective doctors to North Carolina. And whereas the University of North Carolina Asheville has its mission a commitment to integrated liberal arts education, undergraduate research, and community collaboration to connect the traditional liberal arts fields through interdisciplinary studies and to integrate these areas of inquiry with programs that prepare students for a rewarding career. And whereas the University of North Carolina Asheville, as a public university, serves the region and the state in ways that complement its educational mission, it encourages students, faculty, and staff to interact with and serve the community, and it shares cultural and educational resources with citizens of all stages of life and learning. And whereas the trained faculty of UNC Asheville recognizes that this university, with its integrated curriculum, extensive undergraduate research program, internships, and service learning opportunities, is well suited to offer major and minor programs in health and wellness, and fully supports its expanded curriculum in this area. And whereas healthcare and wellness organizations in Asheville and Western North Carolina region appreciate the benefit of such programs and facilities and are eager to collaborate in additional ways to enhance the benefits for its citizens of the region. We, the Board of Trustees of the University of North Carolina at Asheville, do hereby declare our full support for the construction of the North Carolina Center for Health and Wellness and its development of health and wellness curriculum and programs that will benefit current and future students for the university and for the people of Western North Carolina. That was a long proclamation, but I hope that you understood what we were trying to say, that this is for everybody in the region, not just our students, and we want this to be the premier facility in the state and perhaps the country. And I know Wilma and Keith and Janet and the Chancellor all want that for all of us. So many people in our campus have helped educate me and my fellow trustees about health and wellness and the programs we currently have and what we hope to achieve in the future. And none is more articulate about that than our own Dr. Keith Ray, who is the Academic Chair of Health and Wellness Department. And if you'd help me welcome him, he has a few words to say.
Welcome. Once again, thank you for carving time out of your busy day to join us at this very special occasion. I'm often out in the community and people ask me, what is the North Carolina Center for Health and Wellness? I want to start with our mission. The center intends to be a leading catalyst for prevention of chronic health conditions through promotion of healthy living among North Carolinians of all ages, particularly for children, at the workplace, and for older adults. And we're perfectly positioned here between our current fitness facility and the North Carolina Center for Creative Retirement so that we have an opportunity to gain from their expertise as well. About 15 years ago, I met with a group of public health leaders in Washington to discuss a strategy for educating Congress on the need for prevention and healthcare reform. We had a consultant with us that day who said, "Folks, I hate to spoil your enthusiasm and your passion for prevention, but America is not yet hurting enough." Well, in 2008, we're starting to hurt enough. Economically, physically, emotionally. America spends over $2 trillion a year on health care, more than any other nation in the world. And yet more than half of our citizens struggle with one or more chronic diseases. Of all that money spent on health care, less than 4 cents on every dollar is spent on prevention and public health. Out of every health-related research dollar, 94 cents is spent on diagnosis and treatment. Only 6 cents is spent on prevention. Well, we're starting to hurt enough, but not enough yet. Healthy living in America still remains the difficult choice as healthcare costs continue to skyrocket while tens of millions are uninsured and or have limited access to preventive information and care. So, what leadership role would the North Carolina Center for Health and Wellness play in moving America's health strategy forward through prevention? Well, we intend to develop a national community campus partnership model, supporting and engaging every segment of the community to play a role in prevention, including, but not limited to, government, families, schools, the faith community, business and industry, healthcare providers, wellness-related social enterprises, and the media. We know even before we have a building, the Health and Wellness Department has begun operation of a new degree program in health and wellness promotion. We're only in the 3rd year of operation, and we have over 100 exceptional student majors, and we have some of them with us today. Please raise your hand if you're a health and wellness major and you're with us today. This is what it's all about right here. We're very proud of all of them. We're the fastest growing program on campus, and we have over 50 intern sites throughout the region and the state, including, but certainly not limited to, American Red Cross, the I Have a Dream Project, YW and YMCAs, and the Buncombe County Medical Society. And although the Health and Wellness Department plays a key role in the center, poor health is a complex problem, requiring action at multiple levels and expertise from numerous disciplines. So another unique feature of the center is its emphasis on multidisciplinary involvement. So even before we have a new building, faculty and students from 11 different departments already are engaged in community-based undergraduate research, internships, and service learning. Even before we have a new building, we're listening, we're learning, and developing partnerships. Current affiliations and alliances include Mission Hospitals, MAHEC, AB Tech, Western Carolina University Health Partners. And by the way, I would like to introduce one of our very own, the new Executive Director of Health Partners, UNCA alum, Dr. J. Nelson Weaver. Would you please stand? The Healthy Buncombe Coalition, Asheville Buncombe Institute of Parity Achievement, the Cliffs Communities, and their ZestQuest Childhood Wellness Program, local schools, the Workplace Wellness Council of Western North Carolina, and YMCA's Activate America initiative. Even before we have a new building, we're piloting community-based demonstration projects. Current examples include Dr. Melissa Hemmelines getting into fitness together, a program designed to enhance student learning while helping families enjoy physical activity together. Is Dr. Himmeline here today? And Dr. Kathy Garby's Wellness Activities for Seniors in Asheville, a project that improves student learning through service to a diverse group of older adults. Is Dr. Garby here? In 2010, our new building will allow us to accommodate our rapidly growing program in health and wellness promotion, expand our multidisciplinary research projects, share meeting and conference space with our community partners, host regional health fairs, operate summer conferences and institutes, establish an incubator program for wellness-related social enterprises, host an ongoing distinguished speaker series, and expand our demonstration and outreach initiatives. Working together, we will build a national model that enhances student learning, strengthens the economy, and improves the health and well-being of the community. Ultimately, we must work together to create a wellness culture in North Carolina and in America. As North Carolina's public liberal arts university, we stand ready to accept the challenge. If you walk away today and you remember nothing else that I've said, I want you to remember this. We intend to work with the community to make healthy living the easy choice. The easy choice for children, the easy choice for employees at the workplace, and the easy choice for older adults. Now I have the honor of introducing the person without whom we would not be standing here today. It was her unwavering commitment to and belief in what we intend to do that has made all the difference now and will make all the difference in generations to come. We continue to be deeply grateful for her leadership and support. Please join me in welcoming Wilma Sherrill.
Thank you, Keith. Good morning. Once again, thank you for being here on this wonderful, wonderful, exciting day. I don't even feel the cold. Speaker Hackney, elected officials, Chancellor Ponder, colleagues and guests, welcome. I'm going to cut my remarks short because Bruce Goforth and Ray Rapp are really shivering. It was an honor to have served as a member of the North Carolina General Assembly. And one of the most rewarding moments was on June the 17th, 2004, when House Bill 1264 passed, allowing UNC Asheville to construct a health and wellness center. So this is a very special day for me, and many of you can really probably see the excitement building in me that has built since 2004. And I'm so thankful this day is here. Yay. Yay. But I must take this opportunity to thank some other folks that contributed to the success of the General Assembly's actions. I'm so sorry that Chancellor Jim Mullen couldn't be with us because Chancellor Mullen and Dr. Keith Ray and Wayne McDevitt traveled many times to Raleigh for those committee hearings. You know, when you're fighting for something for your district, sometimes it's a little difficult because the other 19 members want something for their district. So thank you, Keith, and for your perseverance in helping me there. And I'm sorry that, I'm not sure if Wayne McDevitt's here, but if you are, Wayne, thank you. I have to also thank Speaker Hackney, Representative Bruce Goforth, and Representative Ray Rapp, and Representative Susan Fisher. They stood tall then, and they're still standing tall now. Thank you so much. Please give all these folks a hand for helping make this day possible. I'm hurrying, folks. But now I'm really excited about being a part of this university. You know, it's great working with Janet Cohn She's really a point guard, and Dr. Keith Ray, but it's also a great honor to work with Chancellor Ponder, who loves this campus as much as I do. She hit the ground running. She immediately recognized the importance of this special appropriation and what it would mean to the economic development of our region, as well as improve the quality of life for our citizens. Now, my excitement makes me just want to go on and on and on and just talk and talk and talk, but what I'm really up here for is the honor to introduce our next speaker, the Honorable Joe Hackney, who's Speaker of the North Carolina House. Joe is an attorney practicing law in Chapel Hill. He also operates a beef cattle farm in Chatham County. Joe and his wife Betsy have two sons. Dan is 24 and Will is age 20. Speaker Hackney is currently serving his 14th, is that right? 14th term as a member of the North Carolina House. He represents the 54th District, which includes Chatham, Moore, and Orange counties. During his years of service, Joe's peers at the North Carolina Center for Public Policy Research has consistently ranked him in the top 10. Now that's out of 120. That's really good. Speaker Hackney has been elected by his colleagues as House Majority Leader, Democratic Leader, Speaker pro tempore, and as you know, last year he was elected Speaker of the House. He is the 2007-2008 President-elect for the National Conference of State Legislatures and has filled many posts as an active member of the Southern Legislative Conference. Joe has received many awards and recognition for his exceptional service. When I looked it up, it was 5 pages, and I didn't think you'd want me to read all those today. But almost anybody you can think of has recognized him at some point. On a personal note, I did have the pleasure of working with Joe Hackney for 12 years, and without a doubt, he commands more respect than most, even across the aisle. He enjoys the reputation of being fair and honest, and he's a dedicated, loyal public servant. I can just think of several experiences that I had with him. We worked on domestic violence, and Joe was right there every step of the way. The ethics reform, you can give Joe Hackney the credit. And he's always been known as a big supporter of the UNC system. Regardless of where the money goes, he cares about the university system. So it's with his leadership, his dedication, that we are honored to have him with us today. I present to you and join me in welcoming Speaker Joe Hackney.
Thank you so very much. I appreciate that wonderful introduction. It's great to be here on this wonderful campus on this exciting day. You could have done a little better with the wind. I just have to, being from Chapel Hill and with James Karpanos on our thoughts and minds, I have to say a word about him as we start here today. Some of you know that with the terrible tragedy, it's a big loss for the Chapel Hill community as well as the UNC Asheville community. He loved this campus. His mom was in my law firm, and it's a sad, sad time, and I just wanted to say a word about James as I started here today. I had an opportunity to tour around the campus earlier with my friend John Curry, and we're going to see some more of it today. But I'm very excited about what Chancellor, what you all are doing for, not only for Western North Carolina, but for all of North Carolina. I join with Representative Goforth and Representative Fisher, Representative Bratt, Senator Queen, who are here, former Representative Sherrill, in congratulating the leadership of this campus and the vision of this campus in creating exactly the right thing for Western North Carolina. You know, we in North Carolina have set our course on education. If you talk about economic development, we believe in North Carolina that training our folks, educating our folks as far as we can make them go is what helps economic development. It takes other things, but we set our course on education. Our university system has been big on planning. The current effort, North Carolina Tomorrow, is a big part of that. The university system is big on efficiency, on putting the component parts of the university system together in a way that makes sense for all of North Carolina. And that's one of the reasons that I'm so excited about this new Center for Health and Wellness, because it fits. It fits with UNC Asheville, with your mission. It fits with Western North Carolina itself. It fits with our need for more professionals in the area of health and wellness and prevention, and also to get folks started on more advanced medical degrees. We need more. This is an important part of our economic development in North Carolina. All of medicine and allied sciences and prevention is going to be such a big part of that as we move into the future. So what this represents is not only good vision on this campus, but good vision across the university system, and hopefully good vision on the part of the North Carolina General Assembly, which has seen fit to fund at least most of this project, with thanks to the private donors who finished it out. I want to tell you that as we compete in this world, as we compete globally, as we try to make sense of what's happening in the world, education is what we need. We will need this. We will need other parts of our university system to be strong in the years ahead if North Carolina is to compete, if North Carolina is to move ahead, and if North Carolina is to take its rightful place as a leader in America and the world. I'm excited about being here today, the opportunity to be here on this campus. I'm excited to be here with my legislative colleagues behind me and with former Representative Sherrill, who had so much to do with this. I'm excited with the direction that you are taking in leading Western North Carolina, and so I thank you for allowing me to be here with you today. Thank you.
Thank you, Speaker Hackney, not only for your inspiring remarks, but for everything you do to make the state of North Carolina such a great place to live, raise a family, educate our children, work. The quality of life we enjoy here is due in no small part to the work that you, Speaker Hackney, and the other members of our General Assembly undertake. We are pleased that you were able to come to the mountains to be with us today, and we look forward to welcoming you here in Asheville, here at UNC Asheville often. We've all heard the phrase, you've got to do the groundwork before you start a project. Right now it's time for us to hand you, Speaker Hackney, and others a shovel so that we can get the physical groundwork started on the new North Carolina Center for Health and Wellness. While we do that, I'd like to thank all of our visitors and colleagues for joining us today. We invite everyone to watch us break ground, and then please stay and enjoy refreshments. There's hot cider, and enjoy this beautiful morning while our photographer takes his photos. What we will have is our warmth and our belief in what comes forward with this project. Thank you all for coming today.
Thank you.